Well, the high cost of treating diabetes means many of us are constantly on the lookout for ways to save money and get the most from our insurance coverage. But it's not always easy to know exactly what is covered. I'm sure I'm not alone in wondering whether I'm getting all the benefits I'm entitled to. And what can you do if you have no insurance at all? Well, here to guide us through the insurance maze is Stuart Perry. He's the vice chairman of the board of directors for the American Diabetes Association. But Stuart also owns an insurance agency, and he's had type 2 diabetes since 1990. Stuart, welcome to D-Life.
Thank you, Nicole.
If you're shopping for health insurance, whether you have a new job or you're just buying a new policy, what should people with diabetes be looking for?
You know, the benefits for diabetes are very, very important and very, very misunderstood. Insurance companies tend to pay for complications, but not for the preventative maintenance that you and I both know we have to do each and every day to manage our disease.
Well, take us a little bit deeper. Now, what exactly should be covered?
With diabetes, what should be covered is doctor visits, is your medications, if you're on a pump, the infusion sets, all those things that you need to manage your disease. You know, some insurance companies are now saying we're only going to cover generic medication. That's a problem because there is no generic insulin. So sometimes insulin is not covered.
Really?
So you have got to make sure what that policy will cover as you go into this situation.
Now, are test strips typically covered?
Test strips sometimes are covered, but they're not sometimes covered enough. You know, they may be covered for 2 a day or 3 a day, and you know yourself how many times you test each and every day to make sure that you stay within those prescribed limits.
Now, what about those people who are just not covered? They're either uninsured or underinsured.
And that's probably the worst scenario out there. If you don't have insurance and you have diabetes, it is just tough to get it.
What about government programs?
Well, there are government programs. There's Medicaid, but you have to be financially qualified for that. Medicare, of course, you have to either have something that gets you into the Medicare program or you have to be over age 65. Some pharmaceutical companies have discount programs, but you have to contact the individual pharmaceutical company, you have to qualify, and those programs don't work quite as well.
Now, desperate times lead to desperate measures often for people with diabetes, and I've heard a little bit about a black market for diabetes supplies.
There's been some national stories about the FBI investigating people who have sold diabetes supplies over some of these, I won't bring up the sites, but over some of these sites. The black market, you don't know whether these things are good, whether they've been opened, whether they've been tampered with, whether they're expired.
From your professional experience, are there any other patient assistance programs that people should be aware of?
In 46 states, there are mandates to cover diabetes supplies and education. However, those are under attack each and every year, each and every day, by well-intentioned but uninformed politicians. And that's something we always have to watch, and everybody with diabetes has to remember that and contact those politicians and say, look, make sure that diabetes stuff is covered. When you talk about health insurance companies, one person can make a difference. There was a lady in Cincinnati whose daughter had diabetes and her supplies weren't covered. She did not give up. She went all the way up the chain of command, the squeaky wheel getting oiled, to the president of the company who had a family member with diabetes who didn't know his own insurance company wasn't covering that. It's now covered.
If a person with diabetes is sitting down with their insurance agent and talking about coverage, what should they say?
I think that they need to sit down and just explain the disease. Some people will be enlightened. With 21 million people having diabetes, there's more people that know about it than you think. And when you sit down and tell your story, more people are willing to help, and I think that's what has to happen.
This information has been so helpful, Stuart. You are setting us on the right path to make sure that we're getting what we need as people with diabetes.